Thank you, everybody, for joining our LHSC London Health Sciences Center May 2025 Community Update Meeting. So before we begin the Community Update Meeting, I want to take a moment to do a land acknowledgement for us. So 1 second with respect to that. I'm going to be giving the land acknowledgement myself. So again, I want to acknowledge and honor the land upon which we stand today. And during my time as a healthcare leader, I've learned about residential school systems, sanatoriums in Canada, and the systemic attempt to erase Indigenous cultures and traditions and the lasting harm in intergenerational trauma that's been caused by this oppression. However, I acknowledge I have much to continue to learn and about the true histories of the Indigenous peoples in Canada. But throughout my learning journey, I've been amazed by the resilience and determination shown by the Indigenous communities to remain true to themselves, their cultures, and their traditions. They've maintained unique identities, languages, traditions in the face of many challenges. It is for this reason I remain committed to continuing learning by listening to stories and experience of Indigenous peoples in Canada and discovering more about how I can better serve the needs of this population. The Victoria University and Children's Hospital are situated on traditional territories of the Anishinaabe, Haudenosaunee, and La'apawek and Chun-Angtong nations on lands connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. I come to LHSC from Windsor with traditional territories of Three Fire Confederacy of First Nations, which includes the Ojibwe, Ottawa, and Potawatomi peoples. I give thanks to the stewards of these lands and acknowledge the benefits I enjoy on working and living on them. So for those of you who have tuned in for the first time, our community update meetings serve as a platform to keep informed about what's happening with our organization, to share updates on new initiatives, and to outline the steps we're taking to deliver on our promise of excellent care. These meetings are live streamed through our website and social media, and also a recording is made available afterwards. Also, our meetings are on replay on Rogers TV London. So I'd like to start by sharing an important safety update on measures across our hospital sites. So as you might be aware, as of May 6th, our new weapons detection system are now in place at the entrance of both the University Hospital Emergency Department and the entrance to the Victoria Hospital and Children's Hospital's EDs. You'll see these systems in place at both sites if you visit, and our security team is present to support you in using them as you enter our facilities. These systems are making an impact and mark a significant milestone in our work to keep staff, professional staff, patients, and visitors safe as they arrive to the EDs. At the University Hospital, where the technology went live April 15th, we've identified many items, including 166 knives, which works out to approximately 5 knives per day. At the Victoria Hospital, we went live May 6th, and since its launch, the system has captured 92 knives, which works out to approximately 6 knives per day. In all cases, these knives were of legal size, and individuals either turn these items in to our security team or return them to their vehicles. In addition, though, we also have identified some prohibited items like batons, pepper bear spray, and these were provided to the police authorities and not given back to the individuals. Again, in the vast majority of these cases, folks who have these items come in with no ill intent. However, they simply don't need to bring them with them to the emergency department. So while it's encouraging that we're getting these items, we will start seeing a drop eventually and a plateau of these items once people learn more and more that they don't need these items to come into the hospital with them. We are receiving some very encouraging and positive feedback from both our team members and patients. The process is smooth, respectful, and helps create a more secure environment for everyone. Again, it's just one extra layer of security in addition to the other layers we have into place. So our security teams continue to play a role in making this work, supporting our people through the process along the way. And I want to thank them and our teams involved and the community involved for their positive feedback regarding this initiative. So before I turn things over to our presenters, I want to note that later this afternoon, I will be sharing a letter to the community on our LHSC website. As you know, with the support of Ontario Health and the Ministry of Health, and through my role as supervisor, we have been working as a team at LHSC to make operational improvements in our hospital. The letter to the community we share will provide an update on this journey on how we're working on improving our finances, governance, operation, policies, and procedures. All of the work that happens behind the scenes to ensure the delivery of great care to you and your loved ones. I'll also share the next steps we'll be taking as a hospital to ensure we continue providing great care for generations to come. I encourage you to review the letter on our website once it's published this afternoon, and I look forward to discussing this work further in future community update meetings. I now turn it over to the guests of our show, and the reason you're here is not to hear from me, but you want to hear from these people. Is number one is we're going to have Deborah Wiseman, our VP of Emergency Services, Critical Care, Clinical Neurological Sciences, and Corporate Nursing Executive, and also Dr. David Stephen, our Department Head, Clinical Neurological Services, and our Interim Chair, Medical Advisory Committee, to share their monthly report to the community. Deborah, David.
Thank you, David. Next slide, please. LHSC continues celebrating 150 years of great care, teaching, and research. This past week, we celebrated Nursing Week, and I really wanted to share the incredible legacy of nursing at LHSC. One that began with the establishment of the London General Hospital Training School for nurses that opened in 1883. At that time, only Toronto and St. Catharines had nursing schools, making London the third city in the country to establish a formal nursing program. Establishing the training program for nurses was part of a broader transformation in healthcare, realizing that properly educated nurses were essential to improving hospital standards and patient outcomes. Training as a nurse in the late 19th century was not just an academic pursuit, it actually was a way of life. Students at the London General Hospital Nursing School, they lived at the hospital, immersing themselves in their education and clinical practice. There are a few stories, but one stands out for me, and that is Alice Grigg. She was one of the school's earliest graduates. She enrolled in the program at 21 and she graduated in 1889. When the school celebrated their 75th anniversary, Alice came. She was 92 and she reminisced about her training days, recalling the stark differences between then and now. She spoke of boiling water over gas heat, the absence of masks in operating rooms, and the use of ocean sponges instead of gauze. What a time that would have been, and I only have part of the history since. Despite these challenges, Alice's biggest takeaway from her time as a nurse was the power of bedside care. She emphasized how a nurse's presence, compassion played a vital role in the patient's healing journey, and that sentiment remains central to nursing today. Our history is truly exceptional, and I'm excited to have you check out the LHSC 150 site for more stories like this. Next slide. As I mentioned, we proudly hosted Nursing Week last night, and that always includes the Nursing Recognition Awards. The event was held on May the 15th, and the annual event is an opportunity to spotlight and celebrate the incredible impact our nursing staff, as well as our interprofessional teams, have. Organized by Nursing Practice Excellence and Innovation, and generously sponsored by the London Health Sciences Foundation, the Children's Hospital Foundation, the WFCU Credit Union, and RBC. The evening honored staff whose work goes above and beyond in the key areas of leadership, education, innovation, and equity. These awards are a meaningful reminder of the dedication and excellence that define nursing at LHSC. All those that were nominated were recognized, and submissions offered the awards committee much challenge given the outstanding patient care, team support, and legacy. Our winners are, next slide, please. Here are our winners, many that are shown in the picture here. This year's recipients were recognized across 9 award categories that reflect the diverse and essential roles of our staff. Advancing equity to mentoring the next generation, each award highlights a different facet of excellence in practice. We were especially excited to present the inaugural LHSC 150 Years Legacy Award. This is a new award category this year, recognizing a long-standing contribution that have helped shape nursing in LHSC over time. And wow, the submissions were absolutely unbelievable. We congratulate all recipients and nominees. Your work continues to make a lasting difference. I'll hand it now over to Dr. Stephen.
Thank you, Deborah, and congratulations to the award winners. And on behalf of the Medical Advisory Committee, thank you to you and all the nurses at LHSC for all the work that you do. So a couple of updates to share. The first is related to human papillomavirus testing, which is a provincial endeavor, which has been live for a few months. So this is a provincial program. So what's new is that the province is shifting from pap smears to HPV testing as the new standard for cervical cancer screening. And this test detects HPV, which causes most, like 95% of all cervical cancers. So the reason for this change is that this type of testing is more sensitive and specific than pap tests and to test the risk earlier. And most people only need to be screened every 5 years with a negative result. So people with the cervix in Ontario, age 25 to 74, who have been sexually active are eligible. And those due or overdue for screening will gradually transition to the HPV test through Ontario's cervical screening program. Next slide, please. Wanted to highlight our transplant program. So the 2025 Excellence in Donation and Transplantation Symposium was held recently, and this celebrates leadership, education, and impact and academics at London Health Sciences Centre. So on April 25th, LHSC hosted its second annual Excellence in Donation and Transplantation Symposium at University Hospital during Be a Donor Month. So the event brought together clinical teams, researchers, donor families, and recipients for a day of knowledge sharing, ethical discussion, and inspiring personal stories. Co-hosted by LHSC's critical care and multi-organ transplant programs, the symposium showcased our role as Ontario's top performing hospital for transplantation. Next slide, please. Just some highlights from the symposium. LHSC ranked #1 in Ontario for transplantation performance. There were 9 what we call NRP cases completed, building on a research first shared at last year's symposium. We hosted the second organ donation simulation day for critical care fellows. So those are trainees that are specializing in ICU care. That was delivered at the Canadian Surgical Technologies and Advanced Robotics, which otherwise known as CSTAR. And we heard powerful stories from Miriam, a donor mother of Zaina, and Jillian Best, transplant recipient and founder of Move for a Life Foundation. And the next slide, please. And I'd like to pass it over to Jerry Plastino for the next update.
Thanks, David, and thanks, Deborah. And good afternoon to those joining online. And thanks for the opportunity to share information about our biomedical engineering team, who play a large role in ensuring the safe and accurate operations of our medical equipment and devices. Next slide. So for those who don't know, biomedical engineering is a team that utilizes engineering principles with healthcare practices, and they have some 4 core accountabilities or responsibilities, and they're really to ensure the safety and performance of all medical equipment, maintain, repair, and manage medical technologies. They collaborate with our teams, the clinicians, the frontline staff, to ensure that we implement innovative solutions when we run into challenges, and we look to drive efficiency and quality in patient care environments. The team is also accountable for meeting our Accreditation Canada requirements as it relates to our preventive maintenance program. Next slide. While the team might be smaller than some of our clinical teams, they are mighty, and they're comprised of administrative and corporate professionals, charge technologists, biomedical technologists and technicians, which make the bulk of the team, biomedical advisors who do the consultation and assessment of devices and work with our clinical teams, senior technologists, and a patient equipment technician. Next slide. So the team supports a number of activities in their day-to-day roles, and we've just highlighted a few of them, and I'll just kind of walk us through them. So our green e-waste management program, this is where the team will work to reduce the volume of medical equipment so it avoids landing in our landfills, promoting environmental sustainability. They participate in trade-in programs for outdated equipment, so it's responsibly handled. And we also make thoughtful donations aimed at educational institutions, helping to advance learning and skills development in the health sector. As I mentioned around preventative maintenance, the Biomed team completes all preventative maintenance that is under their accountability. This includes everything from IV pumps to beds, stretchers, feeding pumps, physiological monitors, medical equipment, medical imaging equipment, and more. As it relates to capital planning, the team is actively engaged with our processes, and they provide input on the technology, the service support models, whether it's a shared service support model, whether it's direct with the vendor, and working with them. As it relates to alerts, recalls, and incident managements, the team will manage no different than when you bring your car in for service. So as we get a Health Canada report, they'll work with that report, identify the risk and the issue related to the equipment. They could provide an immediate response. They could troubleshoot in the moment. We could also remove the equipment from service and replace it with other equipment if needed. Clinical education is something that we always do here at LHSC, and the Biomed team is no different, and they provide education to our team members on how to best use the equipment or troubleshoot when they do run into challenges. Next, from a project implementation, Biomed is a very busy service as they're responsible for rolling out corporate-wide projects that relates to all fleet-based equipment. So that's managing any upgrades, whether that be software and hardware. Next slide. So it might be unknown to folks, but we have over 42,000 medical devices across LHSC. So you can just imagine the amount of work that goes behind the scenes in terms of managing that. And in the last year, we actually completed over 11,000 preventative maintenance requests and over 14,000 repairs. But to keep on top of things, we have to continually train and educate our teams. And so we invested in over 1,200 hours in training to keep on top of new technology. Some of our equipment, 38% of it is over 5 years old, and it's continually, we're adding to the fleet. So we have to, that's to ensure that we're meeting the evolving needs of LHSC. 41% of our equipment is under 10 years old. And again, that ensures that we're taking the proactive steps for long-term planning. Next slide. So our focus for this upcoming year is really to continue integrating our biomedical assessments within our capital planning processes, continue to do staff development and training, ensuring they have all the necessary education and training to support our evolving equipment needs, and then reviewing departmental procedures and identifying opportunities to streamline processes and create an improved end user experience. Next slide. As I sort of close out the presentation, I'd like to take this opportunity to recognize the entire team, as this week is Biomedical Engineering Week. So it's a time to recognize the contributions of our biomedical technologists and technicians. Again, these individuals play a vital role in our team by ensuring that we do have the safe and accurate operation of all of our medical equipment and devices. So happy Biomed Week to the team, and thank you for everything that you do. Now I'm going to hand things off to Tanya Testa, VP of Communications and Community Patient and Client Engagement, and Kara Connors, Director of Patient Experience and Volunteer Service.
Thanks, Jerry. Good afternoon, everyone. Thanks for joining us. I'm really pleased to be joined by my colleague, Karen Connors, the Director of Patient Experience and Volunteer Services, so we can talk to you a little bit about how to become involved as a patient or family member, and one perhaps with lived experience, and what it means to provide feedback to our hospital and to LHSC. LHSC is an organization. So I'm going to hand it over to Karen to walk you through all of our patient engagement opportunities.
Thank you, Tanya. Next slide, please. Hi, everyone. I'm Karen, and I'm the Director of Patient Experience and Volunteer Services. And today I just would like to highlight some of the work that we do within our area. So on the one hand, we have patient relations, and patients and families often engage with our patient relations team members when they have experience at the hospital, a concern, or a complaint that they'd like to bring forward, and we help to support them to move that towards resolution. We only do that in partnership with our physicians and our other leaders. And so it takes that team to help really work to help bring that patient voice that direction. And our patient engagement team, we have 3 staff members who have expertise in recruiting patient and family partners. And patient and family partners are people with lived experience in the healthcare system who bring their voice to various things that we do at the organization. And I'll talk to you a little bit more about that. Next slide, please. So what is patient engagement? Patient engagement is about bringing LHSC and people with lived and living healthcare experiences together as partners and supporting them as they improve the quality of care at LHSC and Children's Hospital. And the amazing thing about our patient and family partner volunteers is they bring their experience in the hopes of helping to really inform improvements for other people, and they volunteer their time in a very profound way. Next slide, please. So how do we support these types of initiatives through patient engagement? Our 3 patient engagement specialists help hospital leaders, staff and physicians learn about patient engagement. They help them understand sort of what are some of the best practices within the field and help them to find people who have lived healthcare experience, our patient and family partners, to work with. We recruit and provide training and information for our patient and family partners so that they it's supported from the very beginning around the groundwork to have a good experience as a patient and family partner. We help connect patient and family partners with hospital activities and committees to help improve care. And we really work to broaden and improve the ways that we engage patients and families and embed their perspectives in everything that we do. Next slide. So at many community engagement events, you may see this poster and this postcard. And one of the things we really are trying to do is really encourage people to think about what their experience has been as a patient or as a family member. And would they like to be interested in being involved as a patient and family partner? And if that sounds like something you would like to do, please reach out to us. We share these postcards at various community events in hopes of really broadening our patient voice. Next slide, please. So some of the ways we do that is we currently have 5 patient and family advisory councils at LHSC, and I've listed them all there. Those councils are regularly engaged to look at things that impact patients within those specific areas. Next slide. And what are some of the other ways that our patient and family partners are involved? Currently, we have approximately 80 patient and family partners, and they volunteer their time on committees and councils. They participate in focus groups and working groups. They actually help review policies and patient-facing material, bringing that lived experience to documents so that we can actually embed that and make improvements around making things more readable. What are the key messages that resonate with patients and families? What's important to patients and families about the things that we communicate? And we also have been involving patient and family partners in recruitment. For example, when I joined LHSC a little over 2 years ago, there was a patient and family partner who was involved in the recruiting process as part of the seeking out a director for patient experience. And patient and family partners who are engaged that way bring a profound voice and ask the most amazing quality partners as part of our recruitment. Next slide, please. So another way that I really want to highlight for the community is over the last almost 2 years now, we have launched patient experience surveys. And sometimes I know when people get a survey, they ask, does anyone look at this? And the answer to that is indeed we do. We are looking at this data every week. And we launched 9 survey types. Everyone who provided an email address and consented to a survey will receive one following their discharge from hospital or an outpatient clinic where we have surveys. And there are more opportunities for new surveys also coming. Through our email responses, we've had really a strong response rate, always around the 37 to 40+%. And that's really quite a profound response for patient surveys. And so if you hear of someone getting one or you receive one yourself, we really would encourage you to take that moment to provide your voice to what your experience was like, and knowing that that information is looked at. Next slide, please. One of the ways that we actually engage patients and family partners, you heard me mention focus groups earlier, is when we developed our quality improvement plan, there is a patient experience indicator on that plan. And in choosing that, this current indicator, we very much involve patient and family partners. And it was through their voice that this particular indicator was chosen. And that question is, did you receive enough information from hospital staff about what to do if you were worried about your condition or treatment after you left hospital? And our target at the moment is 65%. And as you can see, we are starting to gain and surpass that target. And we are currently at 69%. Next slide, please. And the Great Moments Recognition Program is a program that's through our communications department, and it provides the community with an opportunity to really share some of those great moments of your care experience, to say, you know, thank you or appreciation to an individual or a team. Through those kinds of things, we also learn about what are we doing well, and it's really very encouraging for staff when they hear about a moment when they had an opportunity to make a difference in a patient's or family member's experience. Next slide. So if you're interested in patient engagement, there's our email, and would really encourage you to reach out. If you have a concern and you'd like to engage with the patient relations specialist, our information is also there. And I just want to thank you. And if you have any questions at all, reach out to the team. We are very happy to talk about engagement. And I would also want to use this opportunity to send a very huge thank you to all of our patient and family partners for all of the work you do, for the times that you come in and you question us and you challenge us on our thinking. We really appreciate it. It is how we actually help to improve care for everyone. And I will also share with the community, one of the things I've learned from our patient and family partners is how much care and concern they also have for our staff and physicians. And so always the improvements are looking at, you know, how do we make it better for all? And so with that, I'll thank you and turn it to the next presenter, please, which is Tammy and Dr. Moist.
Thank you so much, Karen and Tanya. Such an important program for us here at LHSC. So I'm Tammy. I'm pleased to be here today in my role as the VP responsible for our regional renal program. And I'm thrilled to be joined by my colleague, Dr. Louise Moist, who heads up our division of nephrology. I'm merely going to introduce the program, and then I'm going to hand it over to Louise's expertise. So next slide, please. So before Dr. Moist gets into some of the details around how to take care of your kidneys and all of the things that we do here in the Southwest, I wanted to share a little bit about how broad our program here is and how important it is, especially for dialysis patients, that care is provided close to home. And sometimes that means right in their home. Most of our patients do come to us at least 3 times a week for dialysis, some as many as 5 times a week. So you can only imagine that if care was only provided in London, how challenging that might be to arrange for transportation from places, as you can see on this map, as far away as Owen Sound and Chatham, especially in the winter. So we now have 8 locations across the Southwest and 3 here in London. Combined, this is 150 stations that serve over 600 patients. Even missing one visit can be really significant for someone who is on dialysis. So this regional system of support is key for caring for folks in our community. We are really grateful as well to support over 170 patients with dialysis in their own homes. Our teams here in London and throughout the region help with teaching, equipment maintenance, and troubleshooting for all of these patients as well. But enough from me. I'll hand it over to the expert in kidney care and my esteemed dyad partner, Dr. Louise Moist. Over to you, Louise.
Thanks, Tammy. Just checking in. You can hear me okay.
We can hear you. Excellent. Thanks, Louise.
Great. Thank you. Well, thanks so much for that. And the big issue for us is really about protecting your kidneys. So what I want to do is tell you a bit about what your kidneys do, including that they remove waste and extra fluid from your blood, control all your body chemical balances, ensure your blood pressure is under control, keep your bones healthy, and make red cells. The most important part is taking care of your kidneys. So drink water regularly, control blood sugars, manage blood pressures, eat healthy foods, stay active, don't encourage smoking, and regularly check up with your physician. Next slide, please. There are risk factors for kidney disease. The most common of those is diabetes. So when we look at our dialysis center and to what Tammy alluded to, over 50% of those patients on dialysis will have diabetes. High blood pressure also contributes to kidney disease, as is frequent use of over-the-counter medications such as Motrin, Advil, Aleve. If you've had a history of acute injury, there's a greater risk of chronic, a family history. As we age, our kidneys wear down, and also certain ethnic groups such as Afro-Americans. Next slide, please. What happens when your kidney function declines? Because of what we said it does, people often get swelling, sometimes referred to as edema. They have electrolyte balances such as potassium. They get a buildup of waste products, which we refer to as uremia, and all the acid-base balance that the heart and the kidney do, or the lungs and the kidney do, becomes imbalanced. We manage acute kidney injury. People are admitted to hospital and in our intensive care unit, which results in a sudden decline in kidney function. Typically, that's reversible. And then people who have chronic kidney disease, we hopefully can slow down progression, but often we can't make it totally better, but we can certainly delay progression. And the main goal is to delay getting to dialysis. Next slide, please. So it's important to know your numbers. If you have any of those risk factors or you're interested, you can know your kidney function by getting a blood test for creatinine, which gives us an estimate of the percentage of your kidney function, and a simple urine test. The urine cleans the blood. It's also a filter. So when the filter isn't intact, it can leak protein. So those are the two tests that you'd ask your doctor for to know your numbers. And certainly if you're at risk, it's very important to know those numbers. Next slide, please. Again, chronic kidney disease is not uncommon. 1 in 10 Canadians have kidney disease. It's the leading cause of kidney failure and diabetes, and hypertension is the number 1 cause of kidney, or the number 2 cause of kidney disease. Almost 30,000 people in Canada receive dialysis, and it costs about $70,000 per year. I'd say that's not quite adjusted for inflation, so likely more. Once you have kidney disease, you're at increased risk of heart disease, increased risk of coming to hospital, going to ICU, and in fact, even in dying. It is the 11th leading cause of death in Canada, and it has not improved over the last decade, such as we've seen with cancer and heart. So remains an area of intense focus. Again, unfortunately, 25% of the people we come who are needing to start dialysis did not know they had kidney disease. So bringing back the importance of knowing your numbers. Next slide, please. Again, we have a number of kidney specialty clinics. We heard a bit about transplant, and some of those would be kidney transplant. We have a special clinic for when you have inflammation, referred to as glomerular nephritis in the kidney. We have a very strong renal genetics component. The kidney and the heart are very closely related, so we actually have combined clinics with cardiology, combined clinics with urology for a number of things, including kidney stones. We run a specialized clinic in polycystic kidney disease, a genetic form of kidney disease, and another one in tuberous sclerosis. Next slide. We've heard a lot about research before and a lot about transplant in this. And certainly, as you've heard, we have still mountains to climb in kidney disease, and we believe research works best when it's rooted in community voices. So our team has a basic science, a lot of clinical science based in genetics. We are well above our size in reputation, both nationally and internationally. Our team of researchers are focused on real-world challenges, improving access to care, and sharing what we learn. We do appreciate the community feedback, your questions, and lived experience to help guide our care and research. And we believe that together we can transform kidney care for everyone. Thank you. And next slide, please. And I'll pass it back to Tanya. Thank you very much.
Thanks so much, Dr. Moist. Hi, everyone. It's Tanya. I'm back again to talk a little bit about our Great Moments Recognition Program that Karen mentioned just a few slides ago. And it's such an exciting program that I'd like to share a little bit more about how successful it's been here at LHSC. Next slide, please. As Karen mentioned, we have a Great Moments program that recognizes members of Team LHSC, our volunteers, and even our patient and family partners as well. And this program's been in place since November of 2024. That's when we launched it. And the Great Moments program offers a really easy and meaningful way for patients, loved ones, community members, and colleagues to recognize the efforts of Team LHSC. It helps ensure that our team members are recognized for all the amazing work that they do every single day. But the best part about Great Moments is that it's really easy. So it's super simple to just pull up the form on any of your devices and submit a recognition using that online form for anybody that you've interacted with at LHSC. Next slide, please. For every single submission that we receive, our team members are recognized. Each team member is presented with a congratulatory letter signed by LHSC Supervisor David, as well as a Great Moments lapel pin as a token of our appreciation. And I can tell you that folks walk around with that pin pretty proudly around here, and it's one day something I aspire to be able to wear as well. So these mementos are distributed each month by LHSC leadership, ensuring that everyone that has been recognized has a chance to be celebrated amongst their peers, typically in a team meeting setting where we can all congratulate the person who's been recognized with a great moment. Each month, everyone who's been recognized also gets added into a draw to win a Great Moments prize, and that winner has the option to select a Great Moments tumbler or a sweatshirt, so that they can sort of proudly be named as the big winner for that month. I want to note that our program, the Great Moments program, is really generously supported by our hospital foundations. So London Health Sciences Foundation and Children's Health Foundation have supported it financially in recognition of the importance of celebrating our team members for all of their outstanding care. So thanks to our foundation partners for supporting the Great Moments program financially. Next slide, please. Today, I would just like to highlight one great moment actually that was submitted early on in the program. Roger here is a security guard at LHSC, and he was recognized by a parent after their visit to LHSC Children's Hospital with their son. So their son forgot his items in our hospital, and Roger helped ensure that they were returned. He went on a little bit of a hunt to find the items that the young boy had lost and found them. So here's a little excerpt of what that family had to say about Roger. Roger was delightful and so respectful and provided such great service to me, but most importantly to my son. We are grateful that we had the opportunity to deal with Roger. He was so much helpful to us. He truly put a smile on my son's face. Definitely a 10 out of 10 moment for Roger in security with his skill set, compassion, respect, and professionalism. Well done. So thanks, Roger. Next slide, please. So this is just one example of the 1,350 submissions we've received since November of 2024 for the Great Moments program. If you have a member of Team LHSC that you would like to recognize, I encourage you to please fill out our really simple online form and help us celebrate all of the great moments that are happening every day at LHSC. Thanks so much. I'll turn it back over to you, David.
Thank you, Tanya, and that's a great way to end today, is the great moments, and some amazing stories are captured in that program, as Tanya indicated, and individuals that maybe, you know, you come to a hospital and as a patient or a visitor, it takes a full team effort, and clearly what is being represented in Great Moments is how a whole team makes things happen for the benefit of our patients and families. And I really want to thank the patients and families for taking the time to recognize team members for all they do at LHSC and taking that time. So before we close, I want to remind everyone that we have a web form available for you to submit questions to be answered in these meetings. You can find the link in the description on the YouTube and on the community update meetings page of our website. And we also have a QR code up on the screen for you to scan. It'll take you to the form, submit any questions. Since our last meeting, we haven't received any new questions. So we appreciate the engagement and the encouragement you continue to provide us by submitting any questions you might have. And also your questions will ensure we're addressing the topics that matter most to you. So again, thank you everybody for tuning in. To our media partners, please join us now in our media scrum, and we look forward to addressing any questions you might have. I hope everyone has a great day. Take care, everybody.